Hello, and welcome to the Terp Family Fundamentals webinar series. Thank you for bearing with us for a few extra minutes this afternoon. We were, of course, working through some technical difficulties, but we are incredibly excited to be here with you this afternoon. My name is Kate Belney, and I work in the Office of Parent and Family Affairs. And for those of you who are new, this webinar series is intended to help you become informed consultants on campus resources. So if you remember from our office's presentation during orientation, we like to say that during the normal course of events, there is no problem that can arise at the University of Maryland that a student can't solve using the many resources available to them here. So we understand that your students are going to you for help in their decision making, often when they're in the middle of tackling their problems. So at the end of this webinar, you will see a list of different webinar topics that we plan to host throughout the academic year to really help you be as prepared as possible for a wide variety of challenges that your Terp may have to face while they're here. And so please visit our website, terpfamily.umd.edu, to register for any of those. So you probably registered for today's webinar because your Terp has been perhaps sharing a lot of their feelings with you. Maybe you've never heard them so stressed before. Maybe you're worried that they're not coping the way you would hope they would. Or perhaps your student has used mental health resources before and you want to know more about what resources look like on campus. And I'm sure you have heard midterms in many of the first big papers have really taken off in the last 2 weeks. So undoubtedly your student is feeling extra pressure in terms of their coursework, which may either be causing or exacerbating a mental health need. So today we're going to be joined by Dr. Sharon Kirkland-Gordon and Dr. Theodore Pickett, both the director and acting associate director of UMD's Counseling Center, just to talk a little bit more about what their team does and does not provide on campus, how they make referrals, and then ultimately where you can refer your student depending on their type of need. So feel free to submit questions throughout the presentation. There's going to be an opportunity for me to ask your questions live directly to our presenters, and we look forward to fielding those for you all. So with that in mind, I will hand off the presentation. Welcome so much.
Thank you, Kate. Really appreciate it. Thank you, all of you, for tuning in with us. This is a very busy time of year for our students when they're probably experiencing pressures that come with some of the academic demands that are pressuring them on their time and in their life. When they seek advice from you and they share their thoughts and feelings with you, it's important that you are aware of resources so you can point them in the right direction. We're with the Counseling Center, so before we get started, I want to start with a question and also just giving you some information about our center. So the Counseling Center provides several services for our students, and under the Counseling Center umbrella, there is the Accessibility and Disability Service. We also have the Counseling Service. We have a research unit and a testing office. We are going to focus our attention today on the counseling service and mental health services for our students. So I'm going to start with a question for you. So where is the Counseling Center located? The Stamp Student Union, the Administration Building, the University Health Center, Shoemaker Building, or the Psychology Clinic? We're taking a quick poll.
So my apologies, I spelled union wrong when I made this webinar, but there everybody should be able to see the poll results that came back from folks. So it looks like overwhelmingly folks believe that the Counseling Center is located in the University Health Center, followed by the Shoemaker Building.
Okay. So let's talk a little bit about where we're located, because if you're referring your Terp to counseling, we want them to get to the right place. We are actually in the Shoemaker Building, and that is on the south side of campus, right behind the Memorial Chapel. So if you remember being on campus and taking the tour, you probably passed by our building. And again, it's right behind the Memorial Chapel. It's the big building that looks like that on the screen. Our hours of operation are Monday through Thursday from 8:30 until 9 p.m. And then on Fridays, we're open from 8:30 until 4:30. During the summer, we changed to summer hours and we're open from 8:30 to 4:30 without evening hours. You'll see our website displayed on the slide as well as our phone number. So that's a picture of Shoemaker that may look familiar to you, and that's where the counseling center is located. So the next question for you. The counseling center charges a small fee for counseling services. True or false? Okay. All right. So most of you are aware that it looks like most of you have said false. So most of you are aware that there are no fees for services at the counseling center. All of our services are free to registered students. So a student can come in for counseling, or if they want to see a accessibility and disability specialist, those services are all free. Okay. Sometimes our students want to get information about other mental health services on our campus, and we work in close collaboration with the Center for Behavioral Health, which is in the Health Center. So the counseling service and the counseling center is in Shoemaker Building. The mental health service that you may be familiar with, they recently changed their name to the Center for Behavioral Health. They're located in the Health Center, which is across the street from the Stamp Student Union. Both of these services, we work in collaboration with each other. So let me highlight some of the similarities and differences between our services. Our service, the Counseling Center, is staffed by psychologists and counselors. All of the work that we do is basically around counseling and psychotherapy. Our services are free. We provide personal, psychological, and career counseling services, and we provide up to 8 counseling sessions. The Center for Behavioral Health, is also known as the Mental Health Service in the Health Center, is staffed by psychiatrists who are medical doctors. They have a staff of clinical social workers, and they have nurse practitioners. Their services require a fee or copay, and their services are basically around medication management, psychiatric treatment, and hospitalization. They provide up to 6 sessions of counseling for students who are in therapy, and usually these are students who are on medication. They also have care that comes out of that office, which is Care to Stop Violence. They also provide substance abuse treatment. So we work in close collaboration with each other. We share clients. We provide the therapy. They provide the medication for clients. They also assist us with hospitalization for students who may require hospitalization for a mental health concern, such as students who are at high risk for suicide. We work in close collaboration to make sure that our students are receiving the best possible care. So there are other mental health services on our campus, and these are basically training clinics. So sometimes a student may find themselves in one of these other agencies on campus, and what's important to know is that these are basically training clinics for graduate level students. They are under supervision of licensed professionals, but again, these are basically by and large training clinics, and that is the Center for Healthy Families, and the Y is missing from health. So Healthy Families, the Psychology Clinic, the Care Psychology Center, and Cigna, that's for students on the spectrum, autism spectrum, and the Maryland Psychotherapy and Research Lab. So those are some other training clinics. Those are training clinics. So what do we do at the Counseling Center? Our role at the Counseling Center is to provide, what happens when a student presents to us is that they go through an intake or an initial consultation. That's really the first appointment that they have with us. Our services are then, they may be referred for counseling where they may receive mental health or personal counseling, and that counseling is typically short-term, up to 6 sessions. They may also receive career counseling and testing. We also have a very strong and robust group therapy program, and we're also offering workshops for anxiety and depression. And then we offer referrals also for off-campus therapy. We also provide crisis intervention and emergency appointments. So we are the agency on campus. If there's a crisis on campus, we respond to those crises. We have 24/7 emergency support. So students during our business hours can walk in to schedule an appointment with, not even schedule an appointment, but basically be seen for urgent need without an appointment. And then we have after hours, there's a 24/7 crisis counselor available by phone. So students would call our number at 301-314-7651 anytime after hours, during the weekends, on breaks, holidays, and a crisis counselor will answer their call. We also have our parent and family warm line. It's not a hotline, it's a warm line. And we consult with parents and also family members about their students. So it could be any number of concerns that a parent may or family member may present to us, and we try to help them and work that through. It's called a warm line because we get basically a family member may call us, and then we respond not right away, but by the end of the day, we'll get back to you. We also provide a number of outreach sessions and educational presentations around campus, and we also have referral services available. So what brings Terps to the counseling service? Why do they seek counseling, and what are the kinds of issues that they present with? There are a variety of issues that our students present with. Some of the common concerns, the number one concern that students present to the counseling center is anxiety. Most students who see us are actually experiencing symptoms of anxiety, and the second is basically depression, and that's a close second. There are other issues as well that students may present with, such as difficulty concentrating, low self-esteem and confidence, self-management in terms of time management, and meeting their goals. Loneliness is also a frequent presenting concern, as well as studying effectively. So that sort of gives you a snapshot around the kinds of things that students present with. They also present with career distress. Some students are struggling with deciding on a major and not quite sure what kinds of decisions to make as it relates to their career or their academic progress. So you may be wondering, some of our parents wonder, and family members wonder about talking with their Terp about counseling. And this is often a conversation that may come in various forms. A student sometimes may not come out directly and mention to you that they're interested in counseling. They may basically talk about some of the symptoms they're experiencing, or may talk about being under tremendous stress, or they may mention that they're having a lot of difficulty just managing the workload. Some may tell you that they're feeling lonely, or they're feeling depressed, or they're feeling really anxious. And some may come to our campus already having some mental health kinds of concerns that they've managed in the past when they were in high school, for example, and they may tell you that those kinds of issues are resurfacing. So one of the things that you can do is to engage them in a conversation. And some of the things that you might say to them, one of the things that we sort of engage our students with in terms of having these conversations is that we don't want to mention to them, or the lead into having this conversation is that you have psychological issues and you need to be seen by a therapist. That may not go over so well. So if the student says yes, that they want to seek out counseling, you mentioned that you seems like you're under a lot of stress, and based on what you told me, it seems like you're under a lot of stress, and there are professional counselors on campus who are there to help you deal with the stress. Do you think you want to check this out? And if the student says yes, then you provide all of our information that we're sharing with you today via text or email. If the student says not interested, then your response can be, I hope you'll consider it, and then you provide the counseling center's information via text, call, or email so that they can have it handy. Many times when we hear a student say that they're not interested at that time, but sometimes they present a little bit later, and at least they'll have the information available to them that you already have sent to them. So in that sense, they come to us in many different forms. A lot of times, our parents and families are our number one referral sources. Usually, students, you may be wondering about how long it may take for a student to be seen once you've referred them. Usually, most students can be seen for an intake appointment within 2 weeks. Following the intake, a recommendation may be made for several services we've outlined that a counselor feels is a good match for your students presenting concerns. So it's not always the case that a student will be referred for individual counseling. We try to match your student's concerns with the best possible care. So that could include, it may include individual counseling, but it could be a recommendation that they participate in one of our workshops, or there may be a group that may be more appropriate for the student, or it could be individual counseling, or it may be a referral to the mental health service, or maybe even an off-campus referral. So the referral process. So when you refer a student, and this is related to having that conversation, once you've had that conversation with your student, again, most students come here by self-referral. They usually basically come to the counseling center on their own. And then some are referred by others, such as parents or family members, residence life, the RA, the RD, or maybe a faculty member or staff member, or even their friends. More and more students are being referred by their friends or peers. We also have emergency services here, which is a walk-in service where students in immediate distress, as I mentioned before, can be seen on an emergency basis by a counselor without an appointment. And these are students with an urgent need who may not be able to wait a day or two or a week to get an appointment. They feel that their distress is immediate and they would like to speak to a counselor right away. So when a student comes for an emergency appointment, typically they'll wait, they'll be seen for a same-day appointment, and they may have to wait just a little bit, but they will definitely be seen for a same-day appointment, so they just wait in our waiting room. What we ask is that if you're referring a student for an emergency appointment, if you could call ahead to the counseling center receptionist at the number, at our general number, that can help to facilitate the process and put the counselor on notice that there is an emergency appointment walking over. As you can see on the slide, we're showing you some pictures of our space at the counseling center. The first photo is of our waiting area. So this is where our students actually wait for their counselor to show up for their appointment. They greet them in the waiting area. The second photo and the third photo give you a picture of what a typical therapy room looks like. So most of our therapy rooms and offices where our psychologists provide counseling are generally warm and inviting settings, and I think you can probably pick that up from these photos. So the scope of care. It's really important that you know as an advisor to your students, as their consultant, what it is that we do and what it is that we do not do. We do not provide long-term treatment. That means treatment beyond the 8 sessions of counseling. We do not provide medication or highly specialized services such as neuropsychology, family therapy, hypnosis, etc. we typically will recommend that a student who may need longer-term care or some of the more specialized services, psychological services, to be referred to a community provider. We may also recommend a community provider at peak times during the year when there's a high demand for counseling. And I think this is so incredibly important for you to know that at times when the midterms and if someone wants an immediate appointment for counseling, then that person may be better served to see someone off campus than to wait for a counselor. Sometimes our students have certain preferences. They may want to work with a male or female or someone of a particular religion or someone of a particular ethnicity. And we're really fortunate to have a very diverse staff, but sometimes when there are preferences, that leads to a longer wait for services. But I think it's just important for you to know that we are making the best possible referrals for our students when we find that they may need longer-term care. And we have a list of community providers and a care manager who helps to facilitate that process. So here's another question for you. Is it okay to call my student's counselor to ask if my student is attending their counseling appointment? Yes or no? All right. So this is very interesting. So most of you say that it's not okay to call to your student's counselor to ask if your student is attending their appointment. And about 23 of you or 3 of you have said that yes, you can. Well, the answer is no, you cannot, unless under certain conditions. It's kind of like yes and no. So no, typically you cannot call to ask about whether or not your student is attending their appointment. Once your student makes the connection with us, their sessions and their attendance at their counseling sessions is confidential. So we cannot release that unless they signed a release for us to do so. So if there's a written release, then we can release that information. But we basically just encourage our students and our students' parents and family members to just trust the process of counseling and allow that student to have autonomy over their own counseling sessions. So thank you for answering that question. So this is, as we wrap up, I just want to introduce you to one of our new and very exciting tools that we have just signed on with this company called WellTrack. And this is a self-help mobile app that your students can load on to their smartphone. It's intended to provide helpful strategies to manage symptoms of depression, anxiety, and stress. Included on the app, and this is why we're so excited about this, is that there are relaxation exercises, there's information about stress, anxiety, and depression, there's a Zen room, a daily mood checker, and there are also assessment tools and lots of resources. So we would like to ask you if you can ask your student to download it via Google Play or at the App Store. That would be great. And I think they'll find it to be a really useful tool. At least the feedback we've gotten so far from our students has been really quite positive. And so that concludes our webinar. And Dr. Pickett might want to say something here.
And just to add to that too, your students can sign in or sign up for it using their UMD emails.
Okay. So we'll take a couple of questions.
Fantastic. So you all mentioned that 8 counseling sessions are provided. We've got a question from an attendee who's wondering if this is per year or per semester, and if there are more available at cost, or essentially, if the student uses up their 8, where do they go from there?
Okay, I'm going to let Dr. Pickett, he's going to answer this question.
So the question is a bit complicated, but typically it's 8 sessions. So if a student has had 8 sessions, they'll be available to have another 8 sessions a year from that last session, if that makes sense. So if they had 8 and the therapy ended, it will be another year from that last session that they'll be available for another 8. Now, if a student comes in and say they've had their 8, and 2 months later they come in and they're extremely distressed, maybe they're suicidal, we're not going to say, you've had your 8 sessions, you can't be seen here. Student care is our priority. So we will work with them, get them to a better place. And if for some of the students, if we see that they're going to need continued care, that they may need a therapist that they can see for a little bit and kind of stop and come back, that might sometimes be best served in the community where they can have that consistency. And so we might start looking for, if a student is coming back, every year for therapy or something like that, then we might particularly be looking to see if we can get them connected in community if the resources are appropriate or available.
Great, thank you. So I know we get a lot of calls here in the Office of Parent and Family Affairs when a student has really started to hit closer to that crisis point. And parents and families often are observing, kind of like signs that their student is, becoming overwhelmed. Probably for a couple of weeks before the student finally says, I think I need to talk to someone. How would you all advise parents and families to do, maybe some conversation starters or probing questions to really encourage the student to access resources before they really hit that crisis point where it becomes too much for them to handle? Are there maybe some talking points or things that parents could use when they hear their students starting to kind of edge up on the anxiety levels?
It may be helpful to normalize how stressful school is. I think that that's a great conversation starter. Sometimes they can use their own experiences if they've ever been a college student and how stressful that is, and then talk about there are different times of the year where there's more stress than other times of the year. And then I think providing the resources for them. I think there's nothing wrong with giving them the information even from this webinar that they can just share with them just in case you need it. And again, that's kind of normalizing it before even a problem has been mentioned, but it's giving the student that information so that we can normalize counseling, normalize good mental health, and hopefully the parents and families can say things like, I just heard this webinar today, and I'm not quite sure if you'll ever need this, but just in case, here's the information. And they can send it to them via email or text.
And I would add to that too, that there's, and this depends on the student. So I think each parent or guardian would have to be mindful of this for their student. But there's also a certain normalization of what's appropriate levels of stress. I think sometimes what we run into is students feel like this should not be stressed, but stress is actually helpful. Stress actually helps us respond and perform better. The challenge becomes if stress gets become too much, then our performance starts to go down. But many times I find with students that they can become somewhat avoidant or distressed by the stress itself. Not that the stress necessarily is that bad.
Yeah, I feel like I've heard that a few times in my own teaching you an IB 100 courses. Like, I'm stressed that I'm stressed, that I'm experiencing this feeling. Absolutely. And certainly that's a certain amount of college normal where, you look around and everyone else is stressed and why am I not stressed? Or it's good to feel that way. A couple of clarifying questions for you all. We have you with us. The first is, could you explain what a community provider is? And the second, we've mentioned referring students to discussion groups. If a student was interested in attending a discussion group, would they need to go to an intake appointment to go to that, or is it a resource they could access without an intake appointment?
Okay, so the community provider, this is a person in private practice. This is an independent mental health provider in the community. They have their own independent practice. And typically with your community providers, there are no real limits to care. So the student can continue in therapy without interruption typically until they get to a good place. And there is, of course, some accept insurance, most accept insurance, but some may require that you pay upfront and then get reimbursed by your insurance company. Some are on insurance panels. I would check with your insurance carrier to find out about the mental health coverage and how that works for your particular insurance. The second question regarding, what was your second question, Kate?
Accessing a discussion group. So if you have to go through an intake appointment, or if that's something you want to, your student wants to engage with, like how do they access those discussion groups?
The students who come here for services, they have to go through an intake appointment. So that's the initial consultation. And in that initial consultation, there may be several different outcomes of that. One is that the issues that have been presented seem to be those that can be dealt with via a workshop, one of our workshops. And that's the psychoeducational, cognitive behavioral-based workshops that's been proven to be quite effective. The ones that we're running now are called the Anxiety Toolbox and Getting Unstuck. I always call it tool belt. I don't know why, but it's an Anxiety Toolbox and Getting Unstuck. The Anxiety Toolbox is for depression, anxiety symptoms and stress, and the Getting Unstuck are for mild to moderate symptoms of depression. And the focus of those particular workshops are to focus on the strategies that students can use to manage those kinds of symptoms. But they have to go through a screening to get into that group because we want to make sure that what is presented is a good match for that we're providing the best services for what the student presents.
Fantastic. Well, thank you so much. Those are all the questions that we have for you this afternoon. So if you wouldn't mind just clicking through 2 more slides to our list of remaining webinars for the 2018-2019 academic year. Thank you so much for taking the time to chat with us this afternoon. So as we bring this webinar to a close, I'd just like to remind everybody that a recording of this webinar will be made available on the Terp Family YouTube page, which you can also access through our website, terpfamily.umd.edu. We highly suggest that if this is worth rewatching with another family member, or perhaps even forwarding on to your Terp while they're here at school so that they can review the resources. You will also be receiving an email this afternoon asking for your feedback. Please let us know how we did and how we can improve on future webinars. We truly welcome your thoughts. And we invite you to register at our website for any of these topics. Again, they will be going all the way through May of next year. And so we look forward to having you join us for another webinar. Thank you so much and have a wonderful day.
Thank you.
Thank you.